KSMQ Public Television, Austin, Rochester, Mason City. I'm Eric Olson with another special report on COVID-19 in our area. Talking today with Pam Kellogg, getting an update on Mower County and the public health situation. She joins us from her office. Pam, hello.
Good morning.
Good morning. Hello, good to see you again.
Good to see you.
Tell us, as we sit now, what's the situation in Mower County? We were steady for a while, and then a few extra cases.
Yes, you're right. We were steady there at the end of April, not seeing a whole lot going on. And then May came along, and now we're seeing a rise in cases, not only in Mower County, but in southeastern Minnesota. A lot of those cases we're finding are starting in workplaces, and then it's spreading within their home, whether it's roommates or families. It's kind of spreading that way.
So it's the living arrangements outside of the workplace. The people go to work. That place, the workplace is fairly secure, you're thinking from that standpoint, but it's after they leave. What are folks not doing that they should be thinking about?
What people don't realize is it's easily spread, especially when you're in the household. You're typically with your family members for many hours. And if you are sick and have a positive test, or you just have symptoms, you really should isolate from the rest of your family members. And the family members should quarantine, which means they should also stay home at least for 14 days. We're starting to see, we just got a couple of cases in some children that it started out in the parents, and now it's spread to the children. And we just do not want that to happen.
So I assume employers are letting folks know about that at their jobs, maybe, that to communicate to them and say, hey, when you get out of here, it's not over as far as being careful.
Yes, on the job, it's usually pretty safe, but what they're doing outside of the job, we can't control that. It's important. I really wish people would wear those cloth face coverings when they're out in the community and having to do your essential purchasing. Another thing too, employers have been very generous. We have the Family First Care Act, where people, if you have a positive case and you need to stay home and isolate, you will not lose your job. The employers will not retaliate. They want you to stay home, and you will get paid during this time.
And with the relaxation, or I should say the executive order as we sit now being ended in Minnesota, there might be the impression that, hey, now we don't have to do anything anymore because it must be over with.
It's not over with. It's just delayed. And so the cases are going to continue to rise. We expected this to happen. We certainly didn't stop the spread. We just slowed it down so we could prepare better. But cases are going to go up.
And I want to go back, a very important point about employers and small businesses, as those small businesses open up. From personal experience, I'm speaking to you from our office, but I'm one of only one or two people who are here. Everybody else is remote. Now, if one of your employees gets sick, say, in a case, throwing up, and goes home, what should an employer do? I mean, that's like one little symptom. Do they close everything down and bring in a cleaning crew and have the employee not come back in? It's hard to make those kind of calls.
Right. And that's, we're trying to reach out to as many businesses as we can, but there's so many businesses out there that really, I kind of want to put the responsibility on the businesses to please reach out to us if they have any questions. What should we do? How do we clean? How long do we have to close, or do we even have to close? And so I would like them to reach out to us, and actually the number would really be emergency management, and then they will triage to us.
Okay.
And I'd like to give that number right now if I can.
Yep, go ahead.
The number is 507-396-8227. And if they call that number, emergency management will triage it and get it up to public health if that's where it belongs.
Okay, great. Well, hang in there. I hope your crew is taking care of themselves too.
Yep, we're mostly telecommuting here, except for management is in office, but whenever we're outside of our offices, we have our masks on.
Yep. I'd say just anecdotally, I guess maybe 60-40 in Austin anyway, when I'm at the grocery store or whatever, maybe some days more people are wearing them slowly but surely. It's not 100% by any means.
No, it's not. I wish we could have it higher. It
Yep.
does seem like more people are shopping singly instead of like entire family groups, which is good. Most stores, the less people in there to get the shopping done is better. And I would definitely encourage continue to do that.
All right. Thank you very much, Pam.
Thank you. Have a good day.
Okay, Pam Kellogg, Mower County Public Health, joining us. And for now, I'm Eric Olson, KSMQ Public Television.